Hello, hello, hello. This is Sheriff Fatu. I am the founder and CEO of Heavenly Habits. On this channel, we talk about anything from 65 to death, aging, dementia, disability, and vulnerable populations, and more. Basically, anything we want to talk about because we grown. Amen. But today, specifically, what I would like to talk about is incontinence and urinary incontinence. Sometimes I can feel a little pissy. As I was saying, today I felt just a little bit, because sometimes I suffer from a urinary incontinence. I'm telling you, when I get in and I get ready to get close to that toilet, that's when my stream just starts streaming, and there's no rules or methods to it. I can't hold it back, baby. I don't know if that feels about you, but that was about me. And sometimes, Lord have mercy, I may have to wear a pull up myself. Cause I'm a little pissy at that point. Ain't nothing can change it. But I just gonna let you know. But today we gonna talk about that, amen. Cause I feel the moment, and I feel the mood. I think you do too from time to time. And also, I was talking to my aunt who is 80 years old, and she is about a month post-op. And she was talking this, and she's into this was her third surgery. She had a total hip replacement. And she said, Sherry, I don't feel like I'm back to who I am. After, this is my third surgery, I thought I would bounce back, and she's experiencing some urinary incontinence now. And she said, I don't understand. Why? She said, I don't, he said, because I found myself having to use a pull up myself. And it wasn't like that before. And I told her, I said, again, she's she's an elderly woman. And I told her, I said, ma'am, I said, Auntie, it sounds like, your pelvic floor muscles have been weakened. And there are many factors, including, you know, pregnancy and childbirth, surgery, and getting old can weaken pelvic floor muscles. Um, and, uh, and so that's what happened. This is what happened to her. And when these what muscles are weakened, you can start to leak a small amounts of urine or stool or even gas. And she's been experiencing that lately. And she said that, she thought that she would bounce back, after, this is her third, again, I said this is her third surgery. She's felt like, I should be bouncing back by now. I said, Auntie, first of all, give yourself some grace. Hey man, you are 80 years old. To still have two hip replacements. And first of all, we should be thanking God that you're still alive. Pray, amen. I said, but we can do some things to help you with that and to try to get you back to at least to maybe 70, 80% back to normal. And I told her, I said, have you tried, first of all, asked, have you talked to your doctor about it? She said, that's one of the things, I was thinking about talking to him about. But I said, well, you can please talk to him about it, but also, they may recommend some Kegel exercises. Q exercise is strengthen these muscles, and we're talking about pelvic floor muscles. You know, when you do Kegel exercises, these strengthen those muscles and help to stop the leaking. Also studies have shown that when you do the pelvic floor muscle training, girl, it can improve your sexual function as well. Hey, you may get the girl back about 80 to 90%. That girl might go wild after you do your Kegel muscle exercise, but you work that out on your own time, okay? Amen. And so we went to talk. We kept talking about it. She said, "Just give me a little bit of information about it." And that's all I said. Well, you know, I said, as I told you before, you said I told her don't feel bad. She's not the only one. Both me and your pelvic floor muscle. I said pelvic floor muscles weaken in men and women. Okay, and men and women can benefit from pelvic floor muscle training. Um, just practicing at least, 3 to 4 times daily, in increments of, 10 to uh 15, squeezes can help, can benefit you greatly. And then we're gonna talk about squeezing and all that different stuff. And but I would say is that, just practice it. But I want to say, and I told her, I said, well, so basically, she asked me, you talking about this? She said, what is, what exercises? How do you do them? And I told her, doing Kegel exercises, it's like squeezing, holding, relaxing your pelvic floor muscles. And then she said, well, how do I do that? And I told her, I said, well, Auntie, I said, okay, I had to explain it to her. I said, you know, Kegel exercises. Think of it like this. When you're in an event or you in somewhere and you find yourself ready to pass gas, and you hold that gas and you hold that gas until you get outside, so you won't have pass gas in present company. That is Kegel exercises. So, and I said, if you do that daily, at least 3 to 4, 3 to 4 times, uh, 3 to 4 times daily, in repetitions of 10 to 15, you should see an improvement. She said, well, I know all that gas holding is good. She said, but you don't think about it unless you have to pass gas, you know? And I said, well, we could try other things. I was like, we could try, other things to see you can make you identify, to help you identify those muscles. Other thing is that to help you identify those muscles, you can think about it like this. You can think about it as, think about urinating, okay? Everybody urinate every day, amen? Or you should be urinating every day, okay? Every 1.5 to 3 hours, you should be ready to urinate. That bladder should be ready to empty. But I digress. So think about it. You ready? You're on the toilet and you're ready to urinate and all that good stuff, and you start urinating. Okay, and then when you're urinating, see if you can hold that string. So when you start urinating and you start to urinate, and then just see if you can stop yourself. See if you can stop the flow of the urine. And if you can stop the flow of urine, that's a Kegel exercise. That's identifying your pelvic floor muscles. That is doing a Kegel exercise. You can do that. I mean, if that helps you, you can do that daily. But make sure, and I want to may be clear on this. Make sure, and when it's time to go to the bathroom and use the bathroom, and empty that bladder fully. Okay? Don't play around with that bladder. Stopping your bladder from emptying completely can increase your risk for a bladder infection. So we want to make sure that we are emptying that bladder. Okay? Don't play around with that because we can cause other problems that don't need to be in there if we don't empty that bladder. Right now, I'm just trying to get you to the point to that you can identify the pelvic floor muscles and what Kegel exercises should feel like. Okay. Also, ladies, I say you want to try another identification tool you can use is, ladies, you can insert your finger into your vagina. Once you insert your finger into your vagina, squeeze as if you're trying to hold in your urine. If you feel tightness on your finger, you are squeezing the right muscles. Okay. If you feel that tightness on your finger, girl, you at the right place. I want you at the right place. For males, I know this is not pretty, baby. This is not pretty, but you don't want to be pissy, okay? But let me tell you something. Everybody, as you get older, from time to time, suffer from incontinence, okay? Or suffer from having that urge and not getting to the bathroom, okay? So don't feel bad. Nobody getting on you, okay? Because I'm gonna tell you, every adult got a little pissy from time to time. Okay, okay. But men, if you search to identify the pelvic floor muscles now, and how to understand Kegel exercises. Insert your finger into your anus. Squeeze as if you're trying to hold in your urine. If you feel tightness on your finger, you are squeezing the right muscles. I know it's not pretty, baby, but like I said, brother, if you need to put a glove on your hand, I mean a glove on your hand and put it up in your anus and fill it up, do what you need to do because you need to strengthen those muscles. If you don't start strengthening them now, you're not going, they're just going to get weaker and weaker. And we want to be able to go out, sometimes without our pull up on, or we want to go out and be cute and everything, when we don't want to have, be smell a little pissy all of a sudden. You know what I'm saying? Yeah, you know. Anyway, work it out. Work it out as you can. Okay. But I want to say this to you. Let your healthcare professional help you. Let your healthcare provider help you. Okay? Because I want you to go out there and doing all these keep going exercises and doing all what somebody said this without contacting your care provider because other things may be happening here. It may not just be, it may be, no, it may be something different. It may be your medicines, something else, something else could be going wrong. So I want you to contact your health provider and tell them, look, this isn't right. It could be other, it can also, if post surgery, it could be something else, or something else happening to you post-op. So I want you to make sure you contact them. Many people have, and also too is that when you talk to your health provider, tell them during an examination, ask them to help you. They can use an examination there so they can put their finger in the right area and guide you through it. Like I just said about earlier, they can put their finger and say, okay, I can put my finger in your vagina, and I want you to act as if you're trying to hold your urine or whatever, and they'll say, okay, I feel the muscle squeezing. We've identified that muscle, and we've identified that action. So we've identified the muscle squeezing, and we identified that action, and we understand that that is a Kegel exercise, and that is something that should be done to strengthen your pelvic floor muscles. Okay, and or doctor can put his finger in males into your anus and see if you're identifying, and ask you to again ask as if you're trying to hold that urine again, and see what happens. Okay, this method is it's not hard. Sometimes we just getting it into memory is sometimes the hardest thing. I think, just again, you can learn this method quickly. You find, all you have to do is find and squeeze your pelvic floor muscles. Try and hold them for at least 3 seconds each squeeze. So find your muscles, find that area. Okay, you find that you're doing a squeezing. Try to squeeze for 3 seconds and let it go. And you release when it's time to release and relax those muscles fully. And then you try this for 10 to 15 repetitions each time you exercise. Okay? And make sure that, like I said, make sure if you want to try that on the toilet, you can try it on the toilet after, making sure that after we empty that bladder fully. I know you want us to stop and start the urine stream, stop, because some people say, okay, I can stop and start my urine stream. You know, it may not be, and I need to exercise that, Kegel, do do the work, okay? Just do the work. Talk to your doctor and do the work. Because sometimes you can still stop and start the urine stream and all that different stuff. And so, yes, okay, you maybe have to be able to do that. Just empty the bladder fully and try to keep going through the exercises. If that helps you, then that's for you. If it doesn't, that's perfectly fine. But I want you to talk to your care provider, about everything before you get gun ho and everything. Talk to your care provider. And lastly, I want to thank the National Institute of Diabetes and and Digestive and Kidney Disease for providing accurate information and providing most of the information for this video. So I want to thank them for that, and blessings to them. Also, we're gonna go along to, and we're gonna keep it moving because we're gonna. The rest of this talk is going to be about. I get a newsletter oftentimes, and it's called Aging Care um, Daily, and in this newsletter, it had a question, and I want to pose the question to you, and let's talk about it. And this is a child talking about his parent. And he said, what if he's evidently he had been taking care of his parent, at home. And he said, what if your family member becomes totally urinary and fecal incontinent? What should I do? You know me. I said, first, contact your care provider. Contact the care provider and make sure that you're on the right page. Make sure you're understanding what's going on, because did this just happen recently? Has it been happening for a while? Is there any, can they provide a outreach, some type of outreach, or they can be sitting there and prescribe at home care. They can say, I have found that this individual was identified as home care. Write that up and send it to your send that to your insurance, and then your insurance will take care of contacting home care agencies that may be possibly out to help you. But also too is that what kind of medications is this person taking? Are they taking it in the right dose? Are you giving that patient medications that they shouldn't have? Are you doubling up on medications that you shouldn't put together? So all these different things, like I said, talk to your care provider first, okay, primary care provider, and look at what you're going through. But I want to say this: be kind to yourself. Okay, meet yourself where you are, not where you're supposed to be, and not what somebody else is telling you should be. If you're the total care provider of this individual, then you is you and them, and only you can know what you can do. I want to say this to you, to this is that there's nothing wrong with asking for help. Okay, it's not that person is not your total responsibility. If you have family members, reach out to them. Say, I need to meet that. Say, I need you to come and sit with so and so I can go out or do some work or go out and do whatever you need to do. Reach out to them. But not only that is that you have to think about the big issue. Also, I was talking to my auntie who she gave us she's a total care provider too of my uncle, and I told her, I said, we will never judge you on, she's at 80 years old giving care to an 80-year-old man who's suffering from dementia. And I told her, I said, Auntie, just tell we can do as much as we can do. Tell us what you need. We'll try to get to you, get for. But at some point in time, she may make the hardest decision have she had, has she ever had to make. Because I know she told her husband that she would never put him in a nursing home. Well, she can't. But right now, she's 80. And I don't know, it may be she just been waiting time, because at some point in time, he may not even know her. And he may be combative. And she's 80, she can't fight him off. And, and so I just said is that sometimes it's just be in that moment. Love them in that moment. Do what you can in that moment. Tomorrow will come and you may have to make some hard decisions tomorrow. And I say plan. Do some hard planning and see what you saying. What are we going to do for the long haul? What can you do for the long haul? But if you cannot make those decisions right now, I want you to call to your doctor and let him give you some information, you know. And I want you to, but not only that, I want you to, if you're like my aunt, talk to the children, her children. You calling the children, calling the grandchildren who grown and ask, you need some help, or what do they think? But ultimately, it's her decision. And I told her it's her decision. No one will judge you because you're there. You're the one in the arena. You're the one marred. Marred by circumstances. You're the one fighting. Fighting for life, for your life and that other one's. And right now, is that it's dwindling. And I told her, I said, be kind to yourself. Love yourself. You know, I told her to do something for herself every week. Do something for herself. If it's, just, and I told her, no one is here to pass judgment. No one can pass judgment. If they are not in the arena with you, if they are not at where you are, then they cannot tell you what to do. But I can say this is that you can only try home care is so much. At some point in time, that person may need 24-hour care that you cannot provide, and you are not trained to provide. And that may be the most hurtful thing in the world, and you to find you don't want to put them away. You don't want to, you don't want because that's something, But I want you to also, I don't know, look for where you are, but I want you to look where your loved one is too. They don't know you, and you can't care for them properly, and you can't, and they're bad off. You may have to make the hardest decision to put them in a nursing home, and that's one of the hardest decisions in this life, and no one is judging you about it. But you need to know where you are as well as where the patient is, or I would say, but where your loved one is. And you have to see your loved one clearly and see the truth. Not how, and this goes beyond love, this goes beyond, this is to see the truth. And that person may be bad off unless they are dealt with by a 24-hour care provider. Because you can't provide all the care at 80 years old. So I say this, God bless, be blessed. Help, I know that I want your health to be blessed. I'm gonna end it on that note. Like I said, heavenly habits, God is always blessing. Take care. Until the next one. Bye bye.